at SunCloud, we treat people with complex co-occurring disorders, and we treat the disease package that person brings to us. One of our treatment goals for every single patient is to be able to get at the underlying trauma that we believe most people, we believe that the research shows that everybody, that is alive experiences some way, shape, form of trauma. For some people that turns into PTSD. For some people it's not PTSD, but it's very clinically relevant in driving their depression or driving their self-injury or driving their eating disorder or driving their addiction, right? So we want to be able to get to that level of depth with every patient that comes here. And one of the reasons we want the community as a whole and the patients when they come here not using alcohol, not using weed, is because we want to have, one, a clear picture of what's going on with their biology. And we lose that clarity when there's, it's much harder for me to know if my medications, if it's a problem with the medications that I'm working with a patient on for their depression, if their depression isn't improving or their anxiety isn't improving, if they're also like pouring in a depressant into their body, even if it's just like 2 glasses of wine every night, I don't have a clear picture of what's really going on biologically, because there's more, there are more psychotropically active substances, even though they're not medications, clouding the picture. So diagnostically, it poses a problem, and also treatment efficacy-wise, it poses a problem. Another reason is because we have, most treatment centers are set up in a way that is disease specific. Like we focus on alcoholism here, nobody drinks, right? Or we focus on eating disorders here. So there's a unifying sort of factor that adds to group cohesion, and that really activates the power of the milieu and the power of the group to impact the disease. When you treat people from our model, where person X may have depression, bulimia, and trauma, person Y may have heroin addiction, binge eating disorder, and bipolar disorder, you don't have that everybody here is an alcoholic. So first of all, we don't have that unifying factor, and in part because we don't want people identifying as their disease, right? Like we want people identifying as human beings who deserve the best, to live the best life and the freest life possible for them, for their genetics, for their life experiences. So one of our unifying principles is we want people to relate on a very human level, right? And on a human level, what affects every person is some way, shape, or form of trauma. And we want people to be able to attach and connect deep inside, to be able to explore those experiences, to be able to have exposures to those experiences that come up in process group, and to effectively work through those and get beyond those. That doesn't happen if somebody is, numbed out or disconnected from themselves. The why, which is really twofold, it's a community commitment that everybody commits to, threefold, I guess. Community commitment, so like group as a whole. We want to have a clear picture as a psychiatrist of what's going on biochemically in your body. And then 3, we want you to be able to have access to your feelings and to be able to heal in a way that's going to give you the greatest chances to have long-lasting change from your trauma.